Hello, my name is Jordan Jackson, and today I'll be presenting a combined health system that integrates strengths from 5 global regions: the United States, the Americas, Europe, the Middle East and Africa, and Asia. We'll begin with an outline, and during this presentation, I'll begin with a brief introduction and then highlight key healthcare strengths from each region. Next, I'll explain how these components come together in a global hybrid system, describe implementation strategies, and conclude with a vision for global health equity and a chance for questions. Why combine global health strengths? Every country faces unique healthcare challenges and has developed strengths to address them. But what if we stopped thinking in isolation? What if we could design a unified health system by combining the most effective elements from around the world? In this presentation, we'll explore how such a model can be built using the 4-pillar framework: quality, access, innovation, and cost. Together, we'll examine how global synergy can enhance care delivery worldwide. We'll begin with the USA. The United States leads in medical innovation. It is home to world-class research institutions and cutting-edge technologies, ranking first in scientific advancement. The U.S. excels in breakthroughs across diagnostics, treatment, and digital health. This robust research ecosystem drives innovation, making it a foundational element of high-quality care. We'll move on to the Americas, specifically Brazil. In Brazil and across parts of the Americas, community-based care plays a critical role in improving health outcomes. By prioritizing prevention, building trust, and delivering care through community health workers, or CHWs, these systems extend vital services into underserved areas. Because of community health workers, 2/3 of Brazil's population has access to healthcare, which is huge. Brazil's Community Healthcare Workers Program, one of the largest in the world, has helped reduce under 5 mortality by 75% and maternal mortality by nearly 60%, while also supporting near universal immunization. This model emphasizes local empowerment and preventive care. The photo shows a community healthcare worker providing support in Brazil. Moving on to Europe, specifically going to talk about Germany. Europe offers a strong example of equitable, affordable care through national health systems. In Germany, 86% of the population is enrolled in statutory health insurance. These systems combine public regulation and funding mechanisms to control cost while ensuring high-quality universal access. Though these systems have limitations as discussed in lecture, such as limited provider choice, their core strengths, universal coverage, and cost regulation promote fairness and financial protection. The chart on screen shows nearly stable per capita healthcare expenditure alongside rising life expectancy in Germany. The upper blue line is life expectancy of women in Germany, and the lower one is of men. So moving on to the Middle East and Africa, we'll specifically focus on Rwanda. In regions like Rwanda, healthcare systems have adapted to remote settings through innovative approaches like mobile clinics and task shifting. When the average distance to care is a 47-minute walk, mobile health units become essential. Task shifting, delegating clinical tasks to trained nurses and community health workers, has increased flexibility and reach. These strategies improve care access in rural areas and address the provider shortages they experience. Shown here is a mobile mental health clinic operated in Rwanda by Interpeace and the government, which I think is really neat. Next, we'll focus in on Asia, specifically Japan. In Japan, health systems are built on prevention. Culturally embedded wellness practices and a strong digital infrastructure help reduce chronic disease and improve longevity. Japanese women have the world's longest life expectancy. Recent policies promote cloud-based electronic medical records, AI-driven care, and health data integration. These systems strengthen early detection, coordination, and personalized care. As shown in this image, a majority of those surveyed consider Japanese healthcare better than that in their own home countries. Let's move on to this global health system blueprint. So let's bring these strengths together. We'll combine innovation and research from the US alongside digital integration from Asia, community outreach from the Americas, universal health coverage from Europe, task shifting and mobile clinics from Africa, and preventive practices and AI from Asia. Together, they create a model that delivers high-quality care, broad access, cost efficiency, and ongoing innovation. At the community level, care is delivered by community health workers and mobile units. Digital health platforms connect patients to primary and tertiary care, supported by a cloud-based electronic medical records. Universal insurance ensures everyone is covered regardless of income. Advanced research hubs drive innovation and continuous improvement. One pilot innovation could be a cloud-based AI-supported decision tool for community health workers in rural areas, extending diagnostic power and referral accuracy. Of course, integrating global systems is not without challenges, so here we'll discuss implementation challenges and solutions. Differences in culture, infrastructure, and funding models must be addressed. However, solutions are within reach. Shared funding strategies can support universal access. Global training programs can build a cohesive workforce. Interoperable digital systems can unify care across borders. By embracing global cooperation, we can transform obstacles into innovation opportunities. So, in conclusion, here is a vision for global health equity. A truly global health system is more than a concept, it's a moral imperative. By drawing on the strengths of diverse systems, we uphold the belief that healthcare is a human right. This global synergy highlights that our best solutions transcend borders and can help build a healthier, more equitable world. To quickly recap, we began with an overview of why global synergy matters, then reviewed key strengths from 5 regions: US innovation and tech, community-based outreach in the Americas, Europe's universal coverage and cost control, Africa's task shifting and mobile health, Asia's preventive culture and digital leadership. We then built a hybrid model that layers care from community to specialty settings, supported by technology, training, and regulation. Finally, we address challenges and propose realistic solutions for implementation. This model reflects both aspiration and feasibility. All right, so if you have any questions, I would be happy to respond in the comments. Lastly, here are the sources used throughout the presentation. I hope you enjoyed my presentation, and I am looking forward to hear all of your ideas as well. Thank you.